Hello, I am Mr. Bach, and for this practice demonstration video, I shall be going over the contents and arrangement of the CHN bag, as well as the bag technique and urine testing. So, let's begin. Alright, so first I'll be going over the contents and arrangement of the CHN bag. So, as you can see, this is not your typical CHN bag. So, this doesn't have a top pocket, nor does it have a top inner cover. So first, I'll be going over the contents of the top inner cover. If I had a top inner cover, it would have a 12.5, 18.5 paper lining, a 13.5 by 19.5 plastic lining, as well as a 14 by 20 paper lining. So next I'll be going over the top pocket contents. So inside the top pocket you'll find sterile gloves, a sterile French catheter, a paper waste receptacle, and a small plastic bag. So next I'll be going over the center of the bag. So in the center you'll find the apron. Then as you can see, this is the kidney basin. Then there's your soap dish with soap inside, cotton balls, a hand towel, paper lining, instrument pocket that contains a Kelly curve, Kelly straight, and surgical scissors, sterile gauze, and cotton applicators. So then, at the left of the bag, you'll find a baby scale, a medicine glass, suction bulb, and cord clamp. So then at the back of the bag, you'll find all the solutions. So from left to right, it would be the betadine solution, 70% alcohol, hydrogen peroxide, Lysol solution, spirit of ammonia, and Benedict solution. So then at the right side of the bag, it will contain your tube holder, test tube, match, droppers, alcohol lamp, and denatured alcohol. So at the front of the bag, it will contain thermometer and a 3 or 5 cc syringe. So we're also going to need a folded umbrella and a blood pressure apparatus that contains a sphygmomanometer and a stethoscope, but these do not go inside the CHN bag. Alright, now I shall demonstrate bag technique. First, pull out the paper linings, 14 by 20 paper lining, 13.5 by 19.5 plastic lining, and the 12.5 by 18.5 paper lining. Next, get out the soap dish, the soap lining, and the hand towel. Remove all jewelries or accessories. Then perform medical hand washing. Once you've done that, next step is to take out the apron. Drop the apron, make sure it doesn't touch any objects, and put it on. Next, prepare materials for urine testing. So, this includes a alcohol lamp, test tube, denatured alcohol, tube holder, medicine glass, match, as well as a waste receptacle, plastic bag. Additional materials include the sterile gloves and droppers. Alright, so for urine testing, we're going to need to collect 20 cc's of urine, and you're going to have to use clean catch from the patient. So next is use a medicine cup to pour 5 cc of Benedict solution to the test tube. So this is our medicine cup, and this is our test tube. Just pour 5 cc's into there. Next, you want to add urine to this solution by using a dropper. So let's say the urine is in here. Use a dropper and drop around 8 to 10 drops into the test tube. Then once that is done, you want to ignite the alcohol lamp. Use a match, light it up, and then light up the alcohol lamp. And after that, you want to heat the solution for around 5 minutes. When you're heating the solution, make sure you're doing this swaying motion for 5 minutes, and make sure you're holding it at an angle. So then once 5 minutes has passed, you want to you're gonna have different results. So it's gonna change into, the solution will change into a certain color. Depending on the color, it'll indicate whether it's negative or positive. Blue is negative, while red is positive. So once that is done, you wanna show the client the result of the procedure, and then tell them the interpretation. Then once that is done, you wanna do aftercare. So first you wanna discard the solution. Then you wanna wash the test tube holder, the dropper, and medicine bag. Then put it in the proper place of the CHN bag. Or you can either put it in the plastic bag for autoclaving. Then you want to discard contents of the waste receptacle, and then wash your hands afterwards. And that is all. Thank you.